Thank you for choosing Access Research as your CAHPS vendor. We're excited to help your agency make the most of your CAHPS experience. Today you will receive a complete overview of your AxxessCAHPS portal and learn how to navigate and understand the CAHPS features and reports. Start by securely logging into Access using your username and password. Click on the HHCAHPS service. If you don't see HHCAHPS in the list of Access services, your agency's administrator needs to add you as a user in the CAHPS portal. Adding a new user will be covered later on in this demo. Once you've successfully logged in, you will automatically be directed to the dashboard in AxxessCAHPS. Notice you're on the HHCAHPS tab where you see a graph titled HHCAHPS Trended. The graph shows the survey results in real time from our contact with your patients. The 5 labels on the bottom of the graph, specific care, care of patient, communications, rating 9 or 10, and recommended are items CMS publicly reports, and we provide it so you know how your data is trending for tracking and quality improvement purposes and before submitted to CMS and publicly released. Hover over the data points on the graph in order to view the specific scores for any month for each survey composite. Click on any label to turn it off or back on, and the line in the graph will also appear or disappear to allow you to view the trend of a specific composite. Click on the Public Scores tab to see your CMS reported performance and outcome measures graphed over time. This data makes it possible to track your publicly reported data over time and identify areas of potential improvement. The majority of your agency's survey reports are located under the Reports tab at the top of the screen. Let's look at the different kinds of CAHPS survey reports that Access provides. Select the Reports tab and you will see HHCAHPS, Home Health Compare, and Market Insights. Click on HHCAHPS and you will automatically see the Patient Satisfaction Survey Administration page. On this page, we provide a transparent view into the survey administration process with specific details on each step of the monthly survey process. Notice the white Print button in the top left side of the screen and the red Generate PDF button in the top right of the screen. On the gray column titled Survey Preparation, you can see how many patients were uploaded, how many were ineligible, and how many were actually sampled to be contacted for the survey. In the next gray column titled Survey Results, you can see how many surveys are currently in process, how many have already been completed, and how many surveys are incomplete. In the next gray column titled Response Rate, you can see your monthly survey response rates compared to the national averages per month. In the final column, titled CMS Upload, you can confirm whether or not a sample has been submitted to CMS. CAHPS survey data is typically submitted quarterly per CMS protocol. Notice the report's menu items are also located on the left side of the screen for easier navigation. Select Survey Summary on the menu located on the left-hand side of the screen. The Survey Summary provides a summary of all of your patients that completed a survey for the month. The composite scores in the report match those on the publicly reported CMS Home Health Compare website. You can change the month using the drop-down box located in the top right-hand side of the screen. Patients who have consented to have their names attached to their survey answers are identified here, but if not, the surveys are kept anonymous. Notice how hovering over the question mark symbol next to each survey composite allows you to view which questions comprise that particular category. Clicking on a particular patient allows you to see the details of their survey and how he or she answered each question. The Survey Detail tab on the left side menu allows you to get to monthly summaries of patient results and also to individual patient surveys. Click on the month that you wish to view and the individual patient surveys begin to show. Navigate through surveys by selecting Previous or Next at the top right of the screen. Going back to the left-hand side of the screen, select Survey Comments from the menu. This page provides a summary of all of the patient comments. Again, you can navigate from month to month using the drop-down box in the top right of the screen. Select Summary Monthly on the left side of the screen. This report provides a summary of the data collected for a specific month. The graphs at the top of this page indicate how your agency scored for each survey composite compared to the state and national averages where you're located. Below the graphs on this page, you can see a summary of all of the data collected for the month. This report allows you to view the individual questions and how they're summarized in composite scores and impact your ratings, and can also be used to identify and monitor areas of improvement. Also included are your agency's percentile rank compared to other agencies on the state and national level for each survey question. Now select Summary Quarterly on the left side of the screen. This report provides a summary of the data collected for that quarter. Again, the graphs at the top of the page indicate how your agency scored for each survey composite in comparison to the state and national averages wherever your organization is located. Below the graphs on this page, you can see a summary of all of the data collected for the quarter. This report allows you to view the individual questions and how they're summarized in composite scores and how they impact your ratings. This can also be used to identify and monitor areas of potential improvement. Again, also included are your agency's percentile rank compared to other agencies on the state and national levels for each survey question. Now select Summary Annual on the left side of the screen. This report provides a summary of the data collected for that year. The graphs at the top of the page indicate how your agency scored for every survey composite, and again, it's compared to the state and national averages wherever your organization is located. Below the graphs on this page, you can see again a summary of all the data collected for the year. This report allows you to view the individual questions and how they're summarized in composite scores and how they impact your ratings. The percentile ranks once again are compared to other agencies in your area on the state and national levels for every individual survey question. The next reports are located under the Home Health Compare category. These reports reflect the data that is publicly reported by CMS and made available to consumers on homehealthcompare.com. Select Quality Measures Quarterly. This report provides a detailed summary of your agency's patient care star rating on a quarterly basis. The graphs at the top of this screen indicate how your agency scored for each measure of the star rating compared to the state and national averages where you're located. Select Quality Measures Annual. This report allows you to see how your agency's scores on each measure are trending annually. Now select Star Rating Patient Care, and your organization's Patient Care Star Rating or 5-star rating report will be displayed. Notice that hovering over the question mark for any of the measures allows you to view a description of the measure, how it was calculated, and the measure's data sources. This will assist in better understanding of the CMS measures and areas to improve. The data is updated quarterly as CMS updates the public data. Going back to the left side of the screen, select Competitor Star Ratings under the Market Insights category. This feature will open a map showing the star rating for your agency in red and the surrounding home health agencies in yellow. Essentially, this feature enables you to compare your patient care star ratings to the star ratings of other home health agencies in your area. On the right side is a list of the same agencies, and selecting any one highlights it on the map with its star rating. Select the final report on the left titled Hospital Readmissions. This will open a map showing hospitals in your area and how they've scored on each hospital readmissions measure, compared to the national averages for each measure. There are a few administrative tools which are available under the Admin Tools menu at the top of the screen. There are User Manager, Upload File for non-agency core users only, Patient Review, and File Upload History. Select the Admin Tools tab at the top and select User Manager from the menu list. You'll be on the Manage Users page where you can add users or make adjustments to their access by selecting Edit on the far right side of their name. Selecting the Add New User button in the top left of the screen allows you to add a new user and set their level of access. A name, email address, title, and role is required when entering information to create a new user. The menu item Upload File will appear if your agency is not subscribed to Access Agency Core, and it allows you to upload your monthly sample file. If you are subscribed to Agency Core, the monthly sample file will automatically be downloaded and processed. Selecting this item brings up the Upload File page. This page allows you to select the agency location for the file, browse for the file, and then complete by selecting Upload to complete the upload process. The next screen is the validation page, which provides any exceptions or errors detected while uploading the file. Exceptions are data that are ideally included but not mandatory to proceed. An example would be primary language. Errors are data that are required to proceed with the survey and will need to be updated on the sample form for you to proceed. Examples would be patient's phone number and patient's mailing address. Select Next on the top right end of the screen to move to the review screen. The next menu item is Patient Review, which allows your agency to review the patient file for the current month and identify no publicity patients. At the beginning of each month, an email with a link to this page will be sent out to allow agency administrators to review their sample results. If no action is required, it can be ignored. If action is required, you will have 3 to 4 business days to select the boxes next to whichever patients are considered no publicity patients. Note that no publicity patients are those patients requesting, without being asked if they want to participate, not to be contacted by anyone beyond the agency staff, e.g. celebrities, patients dangerous to staff, etc. Documentation must be kept indicating why a patient is classified as no publicity. Access Agency Core users are able to identify no publicity patients within the patient demographics section in the CAHPS survey section. The last menu item in the Admin Tools list is the File Upload History tab. This page is the history of the uploads of patient sample files which have occurred for your agency, either by your agency or automatically by Access, allowing you to confirm that your CAHPS reports have been successfully uploaded into our system. The final menu item at the top right-hand side of the screen brings you to our client support page. Our expert support representatives are here to answer any of your questions. If you would like to speak directly with one of our representatives, we are only a call or a click away. Please contact our client support department at 1-866-795-5990 or by email at support@axxess.com. Access is proud to offer a variety of resources to supplement your training and keep you in the know of industry news and updates. For more information about our library of educational tools, please visit axxess.com for tutorials, online training manuals, frequently asked questions, and on-demand videos. Thank you for joining our CAHPS portal demonstration webinar today. We know your time is valuable and are happy you chose to spend it with Access.